This is Dr. Christy Webb, and I'm a psychologist in Chapel Hill, North Carolina. Since I started recording and posting videos about borderline personality disorder, dialectical behavior therapy, mindfulness in psychotherapy, and other topics to my YouTube channel, I've gotten a lot of questions about finding a therapist. One of the questions I'm most frequently asked is, how do I know whether a therapist will be a good fit for me? I love this question. I think it's a great question. And, of course, there's no easy answer, since someone can be the best therapist on the planet and still not be right for you. So in this video, I'm going to give you some suggestions that I hope will help you figure out whether a potential therapist and you have a good fit together. Now, obviously, you'd prefer to know whether you and a particular therapist will work well together before you spend too much time with each other. You know, you can learn a lot from someone's website. Spend some time there. No, I mean really, read carefully how the therapist describes him or herself. What problems he or she specializes in. What kind of therapeutic approach does this person use? Do they say? If you don't know anything about that approach, look it up. What are the therapist's fees? Is he or she in network with your particular insurance? Or if they're out of network, you're still covered, but how much help will you get in filing the claim with your insurance company so that you can be reimbursed after the session's over? You can get a pretty good sense of the kind of person this is from a website. Everything from the photos on it to how well organized it is, how easy is it to find the information that you're looking for, to whether there are a lot of typos. These all tell you something about the therapist, so spend time there. I don't recommend paying any attention to online reviews of therapists. An ethical therapist can't encourage her patients to write reviews, but also can't respond to any negative reviews, because even responding discloses whether the person was a patient or not, and that's a breach of confidentiality. So, in my opinion, online reviews say more about the reviewer than they do about the therapist. Now, it may seem easiest to shoot an email to a therapist asking for an initial appointment. And again, I don't recommend this. There are a couple of reasons for it. Lots of therapists do use email, but there are many, like me, for example, who don't, because we worry about hacking and other breaches of confidentiality, and because we have to go into such contortions in order to use email with patients and still be HIPAA compliant. Now, the other reason is, if you pick up the phone and call, you're going to learn a lot about this prospective therapist. For example, what does the outgoing voicemail message sound like? Is it warm and inviting? Is it rushed? Is it businesslike? Does it sound like the person's uncomfortable talking to a machine? How long does it take the therapist to return your call? When they do, are they willing to answer questions? Since my practice is usually full, I often can't take on new patients, but I almost always spend time making sure that the caller has some other names and numbers before we're through. So there you are. You're about to meet this therapist for the very first time. Yikes. I think fit has an awful lot to do with a therapist's interpersonal style, warmth, what the office looks like, and even how he or she dresses. If you're someone who can't think if you're in a crowded or disorganized environment, you're not going to do really well with a therapist who has papers and books piled all over the place. Some people can't tolerate a therapist who doesn't start and end the sessions on time. Others can rock and roll with this more easily. Now, of course, the therapist is going to ask you a ton of questions in that first session, but I'd hope that they're also going to allow you time to ask questions. Now, maybe you don't have any, but I hope that you're at least given a chance to ask. For example, what's their after-hours availability in case you need it? Please do stay away from the personal questions like, are you married? Do you have kids? Red Sox versus Yankees, like that. So now you're trying to make a decision. Does this feel like a good fit? So you can ask yourself things like, did you feel like you were listened to? Was the person prompt, so that the session started and ended on time and you got the time that you had paid for? Did they fall asleep? Sadly, that does happen. Did they seem to dismiss your symptoms and stories as unimportant or irrelevant or minor? Did they tell you what to do, or did they make suggestions? When I've interviewed a prospective new therapist myself, I find it an instant turnoff if he or she tells me in the first session how to solve my problem. You don't even know me yet. And there's a continuum in therapy, from acceptance to change. Some people prefer a therapist who's at the acceptance end of the continuum, who's very sympathetic and may feel more nurturing. Others, on the other hand, prefer a therapist who's more directive, who focuses on solving problems instead of exploring your experiences. There are lots of therapists who are in between, all along the continuum. The most important thing is that you're with someone who has the style that you want. So if you prefer someone who expresses an opinion, you're not going to feel really good about working with a therapist who's non-directive. The most common complaint that I hear has to do with working with folks who are diagnosed with borderline personality disorder. Now, no question, this is a challenging diagnosis to treat. It's a challenging diagnosis to live with. And not every therapist enjoys doing that particular work. So if this is your diagnosis, I cannot say this strongly enough. I strongly recommend that you find a therapist who has been intensively trained in dialectical behavior therapy. You can see my website, or I have another video called If You Have Seen My Videos and You Have Questions, and in both places there are instructions and links for finding a DBT-trained psychotherapist. And what if there is no such therapist in your area? Well then, of course, interviewing a potential therapist is even more important. How willing to learn about DBT is this person? DBT is the gold standard of treatment for borderline personality disorder. It's an evidence-based practice, meaning it's backed up by a lot of research. And so you want to work with someone who is knowledgeable about it or willing to become so. DBT therapists won't fire you for being suicidal. They will insist that you call them after hours for skills coaching, and they'll go to the mat with you if you're committed to keeping suicide and self-harm off the table. So it's worth taking the time to find such a person, if not DBT intensively trained, someone who's willing to meet those criteria. So how about, is a less than ideal therapist better than no therapist at all? Okay, this is what I tell my patients. The answer to every question in psychology is, it depends. I can't answer that for every person or every situation. What I can recommend is that if you don't feel satisfied with your therapist, that you say something. Quite often, the person will be only too happy to listen to you and to try to make changes to better provide what you need. So give them a chance. It's true that sometimes the fit is just wrong. So if you've tried and you still don't feel good about the work that you're doing together with this therapist, say so. Don't just disappear, but bring the work to a close in a manner that's respectful of the efforts of both of you. My hope is that you're going to find these suggestions helpful as you evaluate whether a particular therapist is a good fit for you or not. I think therapy is a precious relationship. I think that it is very like a marriage, and I think it's worth taking the time to find the right person for you. Thanks for watching.